What is the primary purpose of a risk assessment in an animal services environment, and how should it be conducted to minimize workplace hazards effectively? Answer: the primary purpose of a risk assessment in an animal services environment is to identify potential hazards, assess the associated risks, and implement measures to reduce or eliminate those risks. This process ensures the safety of both staff and animals while maintaining compliance with workplace health and safety regulations. The risk assessment should be conducted as follows: identify hazards. This includes recognizing biological hazards, e.g., zoonotic diseases, physical hazards, e.g. animal bites, slips, falls, and environmental hazards, e.g. wet floors or improper chemical storage. Assess the risks, evaluate the likelihood and severity of harm resulting from each hazard, considering factors such as frequency and intensity of exposure. Implement control measures. Use a combination of engineering controls, e.g. secure fencing, administrative controls, e.g. clear procedures and training, and PPE, e.g. gloves, face shields, to minimize risk. Monitor and review. Regularly review and update the assessment based on changes in operations, new risks, or incidents. Compare the circulatory systems of reptiles and mammals and explain how their differences reflect adaptations to their respective environments. Answer: the circulatory systems of reptiles and mammals differ significantly in structure and function, reflecting their respective environmental adaptations. Mammals have a four-chambered heart, which completely separates oxygenated and deoxygenated blood. This structure supports a high metabolic rate and endothermic, warm-blooded lifestyle where efficient oxygen transport is crucial for maintaining constant body temperature, especially in diverse environmental conditions. The separation allows for higher efficiency in oxygen delivery to tissues and organs. In contrast, most reptiles possess a three-chambered heart where oxygenated and deoxygenated blood mix to some extent, although crocodilians have a more advanced four-chambered heart. The three-chambered heart is sufficient for reptiles because they are ectothermic, cold-blooded, and rely on external heat sources for temperature regulation. Their low metabolic demands mean they require less oxygen and can afford the partial mixing of blood. These physiological differences impact the care provided to animals, with mammals requiring more intensive oxygen management in stressful conditions, while reptiles may tolerate more fluctuation in body temperature without immediate health consequences. Emma works at a pet shelter and notices that the storage room for cleaning chemicals lacks proper labeling and the room is poorly ventilated. What should Emma do to address these WHS concerns, and what are the relevant legal requirements? Answer: Emma must take immediate action to address these WHS concerns. She should first report the issue to her supervisor or the designated WHS officer to ensure proper documentation of the incident. If she has training, she may also take steps to label the chemicals correctly following the guidelines set by Safety Data Sheets (SDS). Regarding ventilation, Emma should ensure that the room is adequately ventilated by opening windows or activating any exhaust systems, as poor ventilation could lead to the buildup of harmful chemical fumes. She should also confirm that any cleaning agents used are stored according to WHS regulations, which may require specialized containment or labeling. According to the Work Health and Safety Act 2011, employers are required to ensure that hazardous substances are correctly labeled, stored, and managed. The Code of Practice for Hazardous Chemicals further emphasizes the need for clear labeling, proper storage conditions, and access to SDS for all chemicals. Failure to adhere to these regulations could result in fines or health risks to staff and animals. Emma's actions help reduce the risk of accidents or exposure, ensuring a safer working environment and compliance with WHS obligations. How should a WHS policy be tailored specifically for animal service environments, and what critical components should it include? Answer: a WHS policy in an animal services environment should address the unique risks associated with working with animals, such as bites, scratches, zoonotic diseases, and the physical demands of handling animals. The policy should be comprehensive, ensuring both staff and animal safety. Critical components of the WHS policy include risk management. Clearly outline protocols for identifying and managing risks like zoonotic diseases, e.g. rabies, leptospirosis, and physical injuries, e.g. animal bites, slips. Incident reporting. Establish clear steps for reporting injuries or unsafe conditions, ensuring prompt action and compliance with reporting requirements. Training programs. Provide staff with regular training on safe animal handling, personal hygiene, and emergency protocols for situations such as animal aggression or exposure to infectious agents. Personal protective equipment (PPE). Specify the appropriate PPE required for tasks including gloves, masks, or goggles, especially when handling sick or aggressive animals, emergency procedures, detailed steps for managing accidents such as bites or exposure to chemicals, and provide first aid guidelines. Explain the significance of understanding the skeletal differences between birds and mammals in providing appropriate care in an animal services setting. Answer: understanding the skeletal differences between birds and mammals is essential for providing proper care, especially when it comes to handling, housing, and preventing injuries. Birds have hollow bones and a fused skeletal structure, including a keeled sternum that supports their flight muscles. This adaptation allows birds to be light enough for flight, but also makes them more vulnerable to fractures if handled improperly. For example, improper restraint can cause stress fractures in their fragile bones. Caregivers must use gentle handling techniques and ensure that perches or enclosures do not exert undue pressure on their skeletal structure. Mammals, on the other hand, generally have denser bones which support more robust movements like walking, running, or climbing. Mammals are less likely to suffer fractures from light handling but still require care, especially during transport or treatment where stress or sudden movements could lead to injury. This understanding is critical for trainers and animal service professionals as it informs how they should approach different species, select proper equipment, and create environments that minimize physical harm. Why is it critical to implement a biosecurity plan in an animal services environment, and what key elements should it contain? Answer: implementing a biosecurity plan in an animal services environment is crucial to prevent the spread of infectious diseases between animals, staff, and the general public. Such a plan helps maintain animal health, protects public health, and ensures legal compliance with health regulations. Key elements of a biosecurity plan include hygiene protocols, establish strict guidelines for hand washing, cleaning, and disinfecting animal enclosures, equipment, and surfaces to minimize the spread of pathogens. Isolation procedures. Implement isolation protocols for incoming animals, especially those showing signs of illness, to prevent disease transmission to other animals. Vaccination programs. Regularly vaccinate animals to protect them from common infectious diseases, e.g., rabies, distemper, and encourage staff to stay up to date with vaccinations. Staff education. Regularly train staff on biosecurity measures, including the identification of symptoms of infectious diseases and the proper handling of infected animals, monitoring and reporting. Establish systems for monitoring animal health, reporting illness, and reviewing the effectiveness of biosecurity measures. Max, the veterinary assistant, observes that a dog is exhibiting rapid breathing, lethargy, and a high temperature. What physiological signs should Max assess further, and what immediate action should he take? Answer: Max should begin by assessing the dog's respiratory rate, as rapid breathing can indicate distress or a respiratory infection. Normal rates for dogs are 1.5, 3 aerobreaths per minute, and anything higher may indicate a problem. He should also check the dog's pulse rate, which should be 60-14 beats per minute, depending on size, to assess for any cardiovascular issues. Additionally, Max should assess the dog's hydration status using a skin test. Dehydration could be a contributing factor to the lethargy and high temperature. Max should immediately notify the veterinarian and prepare the dog for further examination. Cooling the dog with damp towels or offering water, if safe, could help manage the elevated temperature. Max should also avoid giving medications unless directed by the veterinarian, as the cause of the symptoms is unknown. He should monitor the dog closely for any additional symptoms and be ready to assist the vet with further tests such as blood work or radiographs to determine the underlying cause. These immediate actions align with standard veterinary care protocols, ensuring the dog's safety and prompt treatment. Discuss the importance of proper nutrition for juvenile animals in an animal services environment and how malnutrition can affect their development. Answer: proper nutrition is essential for juvenile animals, as it directly influences their growth, immune system development, and overall well-being. Malnutrition at this critical stage can lead to stunted growth, weakened immune responses, and developmental delays, affecting long-term health. In an animal services environment, juvenile animals, including puppies, kittens, or young farm animals, should be provided with species-specific diets that meet their protein, fat, carbohydrate, vitamin, and mineral requirements. For example, puppies need a higher protein intake to support muscle and bone development, while kittens require increased fat for energy. Malnutrition can lead to conditions like rickets in young mammals, caused by vitamin D deficiency, or hypoglycemia, a drop in blood sugar levels. Additionally, inadequate nutrition can compromise the development of the nervous system, leading to behavioral issues or cognitive delays. Animal service providers must ensure that juvenile animals receive balanced, age-appropriate diets and that feeding schedules accommodate their growing bodies. Leo is a kennel worker who notices an injured animal with signs of distress. What immediate steps should he take to ensure the animal's safety and report the incident appropriately? Answer: Leo's first priority should be to safely contain the injured animal to prevent further injury to both the animal and others in the area. He should assess the animal's injury while maintaining a safe distance using appropriate personal protective equipment (PPE) such as gloves to avoid contamination or further stress on the animal. After containing the animal, Leo should immediately inform a supervisor or the veterinarian, providing a clear report of the injury and any observed signs of distress. He should document the incident thoroughly in the incident report log as required by workplace health and safety protocols. Leo should also ensure that the animal is separated from other animals to avoid stress or potential aggression. If the injury requires immediate care, he should assist with basic first aid, such as controlling bleeding until a veterinarian arrives. By following the proper incident reporting and response procedures, Leo ensures that the injury is addressed promptly and accurately, protecting the welfare of the animal and complying with workplace safety regulations. How can animal service providers create a culture of safety and well-being for their staff while ensuring compliance with WHS legislation? Answer: to create a culture of safety and well-being, animal service providers must prioritize employee engagement and education. This can be achieved by offering regular WHS training on safe animal handling techniques, recognizing workplace hazards, and responding to emergencies. It is important to cultivate a mindset where safety is a shared responsibility. Staff should be encouraged to report hazards without fear of reprisal, creating an environment of open communication and proactive problem solving. Regular safety audits should be conducted to identify and rectify potential risks, and employees should be made aware of the consequences of non-compliance with WHS standards. Compliance with WHS legislation, such as the Work Health and Safety Act 2011, is essential. Animal service providers must ensure that risk assessments are regularly updated, that appropriate PPE is provided, and that facilities are well maintained to prevent accidents. By implementing safety protocols and establishing a feedback loop, providers can maintain a high standard of safety and ensure the well-being of both staff and animals. Explain the difference between innate and learned behaviors in companion animals. Provide an example of each and discuss how understanding this distinction can help improve training outcomes. Answer: innate behaviors are instinctual, biologically programmed responses to stimuli such as a puppy instinctively suckling from its mother. These behaviors do not require learning or experience. For instance, a dog's prey drive is innate, triggered by movement. Learned behaviors, on the other hand, are acquired through experience, interaction, and conditioning. For example, a dog learning to sit on command is a learned behavior. This can be shaped using reinforcement techniques such as treats or praise. Understanding the difference is crucial for effective training. Trainers can use the animal's innate behaviors as a basis for teaching learned responses. For example, a dog's natural play drive can be harnessed to train it in retrieving games. Identifying whether a behavior is innate or learned helps handlers apply the appropriate methods, such as positive reinforcement for learned behaviors and environmental management for innate ones. Relevant rule: operant conditioning principles as outlined by B.F. Skinner are essential in shaping learned behaviors using rewards and consequences to reinforce desirable outcomes. Mrs. Lee owns a senior cat named Whiskers, who has been diagnosed with kidney disease. She is unsure whether to continue feeding Whiskers his regular dry food or switch to a specialized diet. What factors should Mrs. Lee consider when deciding on a diet for Whiskers, and what nutritional adjustments are typically necessary for cats with kidney disease? Answer: Mrs. Lee should consider several factors. Protein levels. Kidney disease requires a reduction in protein intake to minimize the strain on the kidneys. However, the protein should still be of high quality to meet nutritional needs. Phosphorus. Specialized kidney diets typically have reduced phosphorus levels to help slow kidney function decline. Moisture content. Wet food is beneficial because it contains higher moisture content, helping maintain hydration, which is crucial for kidney health. Veterinary input. Mrs. Lee should consult with a veterinarian to ensure that the diet is appropriate for Whiskers' condition. Switching to a kidney-specific diet that reduces protein and phosphorus while increasing moisture can improve Whiskers' quality of life and manage the disease effectively. A relevant guideline. According to the Association of American Feed Control Officials, OFCO diets for animals with special medical conditions like kidney disease must be tailored to support the animal's health needs while following nutritional standards. Why is behavioral enrichment essential for companion animals, and how can it address common behavioral problems? Provide examples of effective enrichment activities. Answer: behavioral enrichment is crucial because it enhances an animal's physical and mental well-being. Without it, animals may become bored, stressed, or anxious, leading to undesirable behaviors like excessive barking, chewing, or self-mutilation. Enrichment prevents these issues by providing mental stimulation and opportunities for natural behaviors. For example, puzzle feeders and interactive toys engage dogs and cats, offering mental challenges that mimic natural foraging behaviors. Regular training sessions or scent-based games also stimulate a pet's cognitive functions and provide a sense of accomplishment. Animals, especially those in confined spaces, benefit from environmental enrichment, such as climbing structures for cats or digging boxes for dogs. These activities promote physical exercise and reduce stress, resulting in a calmer, happier pet. Relevant rule: the 5 freedoms of animal welfare emphasize freedom from boredom and distress, highlighting the importance of mental stimulation and behavioral enrichment. Compare and contrast the dietary requirements of carnivores, omnivores, and herbivores. How should these differences influence feeding protocols for companion animals? Answer: carnivores, e.g., cats require a diet high in protein and fat with minimal carbohydrates. Their digestive systems are adapted to process animal-based proteins and fats, and they need specific nutrients like taurine and arachidonic acid, which are found only in animal tissues. Omnivores, e.g., dogs can digest both animal and plant matter. They require a balanced diet with protein, fats, and carbohydrates for energy. Unlike carnivores, omnivores can process a wider variety of foods, including vegetables and grains. Herbivores, e.g., rabbits primarily consume plant-based diets and require high fiber for proper digestion. Their digestive systems are designed to extract nutrients from fibrous plant matter. Feeding protocols must reflect these dietary needs. For example, cats should receive a protein-rich diet with no plant-based fillers, while dogs require a more balanced mix of protein, fat, and carbohydrates. Herbivores need fiber-rich foods like hay for healthy digestion. Relevant guideline: the Association of American Feed Control Officials, OFCO, provides guidelines for formulating species-specific diets that meet nutritional needs. A bag of dog food lists the following on its label: protein min, 20% fat min, 10% fiber max, 4% moisture max, 12%. What does this information indicate, and how should it guide a pet owner's choice? Answer: the label indicates the minimum levels of protein and fat and the maximum levels of fiber and moisture in the food. Protein min 20%. This percentage represents the minimum amount of protein in the food, essential for muscle maintenance and overall health. Fat min 10%. This provides essential fatty acids and energy. Fiber max 4%. Fiber helps with digestion but should not be too high, as excess fiber can reduce nutrient absorption. Moisture max 12%. The moisture content affects the food's freshness and is critical for hydration. Pet owners should choose food based on their pet's age, activity level, and specific health needs, ensuring that the food offers a balanced diet that meets their pet's requirements. Relevant guideline: the Pet Food Industry Association of Australia, FIA, mandates that all pet foods meet specific nutritional standards, which can be verified through labels. Describe feeding strategies for companion animals recovering from illness or surgery. What considerations are critical in ensuring their nutritional recovery? Answer: feeding animals recovering from illness or surgery requires special care. Easily digestible foods. For animals with compromised digestion, bland foods like boiled chicken and rice can be beneficial in the early recovery phase. Caloric density. High-calorie foods help animals regain lost weight and energy. Specialized recovery foods often contain additional nutrients like vitamins and minerals to aid healing. Hydration. Ensuring that the animal has constant access to water is crucial, especially if they are dehydrated from illness or surgery. Small, frequent meals. Rather than large meals, small and frequent feedings may be easier on a recovering animal's digestive system. By adhering to these feeding protocols, owners can help their pets recover faster and prevent complications associated with malnutrition or dehydration. Relevant rule: the FEDIAF guidelines for pet food ensure that recovery diets provide the necessary nutrients and calories to support healing. How do genetics and early socialization contribute to behavioral outcomes in companion animals? Answer: genetics influence an animal's temperament, predisposition to certain behaviors, and overall personality. For instance, some breeds are naturally more active, while others may be more passive or protective. Early socialization plays a crucial role in shaping behavior. Puppies and kittens exposed to various stimuli, people, environments, other animals during critical developmental periods are more likely to grow into well-adjusted, adaptable adults. In contrast, lack of socialization can lead to fearfulness, aggression, or other behavioral issues later in life. A well-rounded upbringing combining genetic predisposition with positive early experiences is key to fostering a balanced and confident companion animal. Relevant guideline. The American Veterinary Society of Animal Behavior (AVSAB) emphasizes the importance of early socialization in preventing behavior problems. What are some effective techniques for training a dog to stop barking excessively? Answer: to stop excessive barking, several training techniques can be employed. Positive reinforcement, rewarding quiet behavior with treats or praise. Desensitization, gradually exposing the dog to the stimulus that causes barking, such as a doorbell, while rewarding calm behavior. Redirection, diverting the dog's attention to another activity like fetching a toy when barking begins. Training commands, teaching commands such as quiet, and rewarding the dog for stopping barking when instructed. These techniques, especially when combined with consistency, can help reduce excessive barking over time. Relevant guideline. The American Kennel Club Act recommends positive reinforcement for training dogs, focusing on patience and consistency. What are the benefits of early socialization in puppies, and what key experiences should be included in their socialization period? Answer: early socialization in puppies is essential for their development into well-adjusted adult dogs. Puppies undergo critical socialization period, typically between 3 to 14 weeks of age, during which their experiences shape their behavior for life. Benefits of early socialization include a reduction in fear-based behaviors, aggression, and anxiety. Puppies exposed to various people, animals, and environments during this period are more likely to grow up to be confident, adaptable, and friendly dogs. Key experiences should include exposure to different environments, different types of surfaces, sounds, and locations, e.g., parks, city streets, homes help puppies become comfortable in a variety of settings. Interactions with other dogs and animals. Positive experiences with well-behaved dogs teach social skills and prevent future aggression. Handling by humans. Being gently touched and handled by various people helps puppies tolerate grooming, veterinary visits, and other necessary interactions throughout their lives. Exposure to various stimuli, everyday objects like vacuums, car rides, or bicycles can desensitize puppies to common triggers, reducing fearfulness. How do genetics influence behavioral traits in animals, and how can breeders account for this in their breeding practices? Answer: genetics plays a significant role in shaping an animal's behavior, influencing traits such as temperament, fear response, social tendencies, and trainability. Some breeds are naturally more energetic, protective, or docile, while others may exhibit higher levels of aggression or shyness. For example, border collies are known for their intelligence and herding instincts, while bulldogs are typically more laid back and less energetic. Understanding the genetic predispositions of a breed helps breeders anticipate behavioral tendencies in their offspring, allowing them to select for specific traits. Breeders can account for genetics by selecting for temperament. Breeding individuals with calm, well-adjusted temperaments can reduce the likelihood of behavioral problems in future generations. Screening for behavioral traits. Some breeders test puppies for specific traits, e.g., socialization, trainability early in life, ensuring that animals with desirable characteristics are chosen for breeding. Educating new pet owners. Breeders should inform prospective owners about the genetic predispositions of the breed, ensuring that owners are prepared for the behavioral traits their new pet may exhibit. Mrs. Cutter brings her dog Bella, a golden retriever, to your animal care facility. She mentions that Bella has been lethargic and not eating well for the past 2 days. Upon examination, you notice Bella's gums are pale and she has a slightly elevated heart rate. Answer: in this situation, immediate action is crucial. First, assess Bella's condition more thoroughly by checking her temperature, respiratory rate, and hydration status. Pale gums can indicate anemia or circulatory issues. An elevated heart rate may suggest distress, shock, or other systemic issues. Notify Mrs. Carter about Bella's condition and recommend urgent veterinary consultation. While waiting, ensure Bella is in a quiet, stress-free environment. Offer water if she is willing to drink, and restrict movement to avoid aggravating her condition. From a legal perspective, it's essential to maintain professional boundaries. Under the Animal Care and Protection Act, you are responsible for advising the owner about seeking veterinary care without diagnosing or treating conditions beyond basic first aid. Ensure informed consent is obtained if any action is taken, such as stabilizing the dog for transport. Document all findings, recommendations, and actions taken to comply with ethical and regulatory obligations. Your role is to provide first aid and stabilize the animal while acting within the law to avoid practicing veterinary medicine without qualifications. What are the key components of a first aid kit for companion animals and why are they necessary? Answer: a well-equipped first aid kit for companion animals includes sterile gauze and bandages to cover wounds and control bleeding, antiseptic solution to clean cuts and prevent infections, digital thermometer to monitor temperature for fever or hypothermia, tweezers and scissors for removing foreign objects or cutting bandages, muzzle or towel to safely restrain a distressed animal, activated charcoal for managing certain poisonings, emergency contact numbers for quick access to local veterinarians or poison control centers. These components are essential for providing immediate care before a veterinarian can intervene. A first aid kit enables basic treatments like stopping bleeding, cleaning wounds, or stabilizing an animal until it can receive professional medical care. Under the Animal Welfare Act, animals in your care must be treated with respect and provided with appropriate care in emergencies. A well-stocked first aid kit supports this responsibility by ensuring that minor injuries or conditions can be addressed promptly, improving the chances of a positive outcome. Describe the correct technique for performing CPR on a medium-sized dog and explain the legal implications of attempting CPR as a layperson. Answer: to perform CPR on a medium-sized dog, follow these steps. Positioning: lay the dog on its right side. Chest compressions: place both hands over the widest part of the ribcage, compressing at a depth of about 1.3 to 1.2, the chest depth at a rate of 1.0.0.120 compressions per minute. Rescue breaths: after every 30 compressions, give 2 rescue breaths by sealing your mouth over the dog's nose and blowing gently to inflate the lungs. Continue CPR, alternate between 30 compressions and 2 rescue breaths until the dog revives or professional help arrives. The legal implications for laypersons performing CPR are significant. In many jurisdictions, laws like the Good Samaritan law provide protection from liability if actions taken are in good faith and intended to help the animal. As a non-veterinarian, it is essential not to attempt advanced medical procedures such as defibrillation or drug administration. Failing to follow proper protocols could result in legal consequences if the animal's condition worsens due to inappropriate care. Why is regular grooming important for long-haired breeds, and what are the consequences of neglecting this care? Answer: regular grooming for long-haired breeds such as golden retrievers or Shih Tzu is essential to prevent matting, which can lead to discomfort, restricted movement, and skin infections. Grooming also removes dirt, dead hair, and parasites, helping maintain a healthy coat and skin. Neglecting grooming can cause mats to form, pulling at the animal's skin and causing pain. Severe matting can lead to hot spots where the skin becomes irritated and inflamed, creating open wounds that are vulnerable to infection. Parasites like fleas or ticks can also become trapped in unkempt coats, leading to further health issues. In addition to physical health, poor grooming can impact an animal's emotional well-being, as mats and tangles can cause irritation and anxiety. From a regulatory perspective, grooming practices must comply with the Animal Welfare Act, which mandates that animals in your care are provided with proper hygiene and attention to their health. Regular grooming is part of fulfilling your duty of care and ensuring the animal's overall welfare is maintained. Lily, a 2-year-old Labrador, has sustained a fracture after falling off a staircase. The owner, Mr. Brown, seeks your help. Answer: immediate actions. Control bleeding. Apply pressure to any bleeding wounds with a sterile dressing. Immobilize the limb. Use a soft padded splint or towel to stabilize the fractured limb. Avoid attempting to reposition the bone. Minimize movement. Keep Lily as calm and still as possible to prevent further injury. Transport to vet. Carefully transport Lily to a veterinarian for x-rays and further treatment. Legal and ethical considerations. As a non-veterinarian, you cannot perform advanced medical procedures like setting a fracture, as this constitutes an authorized veterinary practice under the Veterinary Surgeons Act. Your role is to provide basic first aid, prevent further injury, and stabilize the animal until professional care is available. Ensure informed consent is obtained from Mr. Brown for any actions taken. Documentation. Maintain accurate records of your actions and the condition of the animal. This ensures transparency and legal protection for both you and the animal's owner. What is the correct process for managing odors in animal enclosures, and how does it support compliance with hygiene regulations? Answer: to manage odors in animal enclosures effectively, regular cleaning, Clean enclosures daily using non-toxic disinfectants to remove waste, urine, and food remnants that contribute to odors. Ventilation. Ensure good air circulation by using fans or opening windows, which helps dissipate strong smells. Absorbent bedding. Use high-quality absorbent bedding materials such as shredded paper or wood chips to minimize moisture buildup, which can lead to foul odors. Waste disposal. Implement a proper waste disposal system to remove soiled bedding and excrement promptly. Effective odor management ensures compliance with animal welfare standards and the code of practice for the housing of animals, which require that animals are housed in clean, safe environments to maintain their health and welfare. Poor hygiene can contribute to health problems such as respiratory issues, skin infections, and overall distress. Managing odors also improves the working environment for staff and reduces complaints from the public. Explain the difference between treating a superficial wound and a deep laceration on a companion animal. Answer. Superficial wounds. These are small, shallow cuts or abrasions that affect only the skin's outer layers. Treatment involves cleaning the wound with saline solution or antiseptic, applying a sterile dressing, and monitoring for signs of infection. Deep lacerations. These wounds penetrate deeper into the tissue, potentially damaging muscles, tendons, or bones. The treatment involves controlling bleeding, stabilizing the area, and seeking veterinary attention immediately. Do not attempt to close the wound yourself, as this could lead to infection or further injury. Legally, deep lacerations must be treated by a licensed veterinarian under the Veterinary Surgeons Act. As a layperson, your role is to provide first aid and stabilize the animal until professional care is available. How does hydration affect the health of animals during summer, and what strategies can ensure adequate hydration? Answer. Hydration is critical for preventing heat stroke, dehydration, and electrolyte imbalances, especially in hot weather. Dehydration can lead to organ failure, reduced circulation, and even death. To ensure adequate hydration during the summer, provide fresh water. Ensure animals have access to clean, fresh water at all times. Offer wet food. If possible, provide wet food to increase fluid intake. Shade and cooling. Ensure animals have access to shaded areas and cool environments to avoid excessive heat. Monitor for dehydration. Watch for signs such as dry gums, lethargy, or sunken eyes, which indicate dehydration. By adhering to the Animal Welfare Act, ensuring proper hydration is part of the duty of care for companion animals in your care and can prevent serious health issues. What is the role of socialization in the development of puppies and kittens? Answer. Socialization is crucial for puppies and kittens as it helps them become well-adjusted and confident adults. Early socialization between 3–4 weeks is especially important for developing appropriate behavior and reducing fear responses to new people, animals, and environments. Effective socialization includes introducing the animal to various environments, sounds, and situations, ensuring positive interactions with people and other animals, exposing the animal to different textures and experiences to reduce anxiety. Failure to socialize animals properly can lead to behavioral issues like aggression or excessive fear in adulthood. Socialization also supports the development of healthy attachments to humans and improves overall welfare. Mr. Johnson's cat, Felix, has been vomiting frequently over the past 24 hours and is acting lethargic. Upon examination, you notice that Felix has not eaten and appears dehydrated. What steps should you take to manage Felix's condition until veterinary care is available? Answer. In this case, the first priority is to stabilize Felix and address dehydration, hydration. Offer water to Felix slowly to avoid further vomiting. If Felix refuses to drink, you can administer small amounts of water or an electrolyte solution using a syringe, taking care not to force it. Prevent further vomiting. Do not offer food until the vomiting stops for at least 12 hours. If vomiting persists, immediately contact a veterinarian. Monitor vital signs. Observe Felix's temperature and overall condition. A body temperature above 39 Tudic 102.5 dec could indicate a fever, while a temperature below 37.8 dec 100 dec could suggest hypothermia. Avoid stress. Keep Felix in a quiet, comfortable environment to minimize stress, which can exacerbate the symptoms. From a legal perspective, you must recognize the limits of your scope as a layperson under the Animal Care and Protection Act. You cannot diagnose or administer medications. Your role is to stabilize Felix and facilitate a prompt veterinary visit.